As therapists, we know the work doesn't end when the session does. There's scheduling, notes, billing, and insurance follow ups waiting for you. That's why we're big fans of tools that actually make the admin side easier. Simple Practice is an all in one EHR built specifically for therapists. So everything lives in one place and you can focus on your clients. Learn more at simplepractice.com/therapy reimagined.
This episode is sponsored by The Receptionist for iPad, a visitor management system that allows you to easily check in clients and take your time back. Learn more by visiting thereceptionist.com/MTSG and get your first month free.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhalm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhalm with Katie Vernoy, and this is the podcast for therapists about the things that we do in our practices, things that we do in our profession, the ways that we go about doing what we do. And feels like the headlines over the last couple of years, as far as the economy goes, we've talked about it earlier in this month, as far as things don't seem to be working out for everybody so well anymore. You remember 2021? It was kind of that golden age of starting private practices. And even we were talking about having niche down, get your exact kinds of ideal clients. And that was when, frankly, mental health was really being sought out by everybody. Everybody was trapped at home during COVID. And it seemed like clients were coming from every which direction. A lot of people who were already in private practice were extremely busy. You and I were. A lot of people looked at it as opportunities to start their private practices, did really well. There was kind of a groundswell of a lot of new platforms that would help therapists be able to fill their week. And then the economy that we have now happened. And Katie and I wanted to kind of dive into what we've been seeing, which is a lot of people finding that it's harder to fill their caseloads. The platforms seem to be pivoting some different ways. A lot of people are maybe leaving private practices, whether they be digital or brick and mortar, and pivoting more into some agency type work or rounding out their income in some other ways. So we are here to talk about this trend, talk about the whys of why it's happening, and maybe some things to look at this in kind of a positive light and some ways that it might be rather intelligent. So, Katie, what have you been seeing as far as this conversation in the larger therapist world?
There's the move that you mentioned, which is private practice to agency, and that can be full-time or part-time. There's moving solo practice to being an employee of a group practice. So some of the things that are required by someone on their own is taken care of by someone like Curt Widhalm.
Hmm.
And then there's looking at moving from private pay to insurance. One that we may end up doing a whole episode on, moving from being a group practice owner back to kind of doing solo practice. There's my journey, moving agency to private practice. And I think there's even folks who maybe they're not getting their themselves fully accredited on insurance, so they're private pay, and then they'll join one of these platforms to fill out their caseload. And being in this career is very volatile. Business ownership is volatile in all regards, but our career so relies on us being on, being capable, and having our wits about us. And so when finances are unstable, we have things going on personally or those types of things, it is really hard to keep trudging through, whether it's hustling or working in a system that is not sustainable. It really is challenging. And I think the additional piece that comes in is this: I should be successful in this particular path. And if I am not successful in this particular path, then I have failed. And I don't know. It's a way to continue forward with ambition, with your life's mission, and it may be short-sighted. And so I'm excited about this conversation because I think when we talk about the flexibility that we have as mental health professionals, it is actually kind of cool. But when we think about this ideal path of, the 6-7 figure, individual or group practice, the Zen-like ability to take care of myself in every way, it can be very appealing to a lot of folks. It may not be possible in the current environment.
So a couple of places that I looked at, and we can include these in our show notes over at mtsgpodcast.com. The 2025 Thrizer Mental Health Insurance and Marketing Report, as well as the HERD 2025 Financial State of Private Practice Report, as just a couple of examples.
And the conversation we had with Lindsay last week from Simple Practice and their state of the profession for private practitioners.
So we're bringing just more than vibes from Curt and Katie and reporting on what we're seeing in therapist Facebook groups here. But I think reflecting on the overall trend is the people who have been previously successful in private practice continue to be successful in private practice. But according to this HERD report, that there's still a third of private practitioners whose gross income is less than $25,000 per year. And that's across 48 states. Sorry, South Dakota and Mississippi. Nobody responded to them for their report. But
so respond to things, North Dakota. Or is it South Dakota?
South Dakota.
Dakota.
But the K-shaped economy that we've been hearing about is definitely still very much in place. And what I've learned in now 15 plus years of running a private practice is that things don't stay the same. There are changes. There are things that we have to adapt to. And not everybody necessarily has the convenience, the privilege of being able to step back and plan out when the next change is going to happen. Now, I like to sit on our high horse, or that
we have a high couch on top of a horse.
Yeah, sure. That at the 2020 or 2021 Therapy Reimagined conference, you and I were talking about the VC companies are coming, and they're coming for our jobs, and people should niche down, and they should talk about what are the things that can be done that aren't necessarily just telehealth based or aren't just necessarily venture company based. And in my practice at the time, we made a very distinct decision. We wanted to focus on the people that couldn't be served by the online sorts of spaces. So we really leaned into higher acuity cases. We really leaned into working with kids. We really leaned into people who didn't want to be seen online. Now, we're still seeing, I don't know, a third to half of our clients online, but we had the kind of foresight, you and I, and then also my practice employees and myself, to be able to say, there are going to be trends that change, and we want to make ourselves resilient against those. And so by leaning into higher acuity type clients, the trade-off was we have higher acuity clients that we have to build a practice around and be more responsive to in between sessions. And we're one of the practices that is fairly resilient, at least as of the time of this recording, to be able to say, while we're seeing a dip in people reaching out to us like everybody else, we've also positioned ourselves as a place that people need to go to, rather than one of the things where, what's the thing that I've heard in recession times before, that the things that go out the window first when people are starting to cut their budgets are haircuts and therapy. So if
things that are seen as a luxury.
Exactly. And so putting the privilege of having 10 years of experience of running a business ahead of that, I want to also say that if you are scaling back your private practice, if you are looking at this as a way to create more stability for your income, your needs for health insurance, your needs for being able to make sure that you have a 401k, it's not a sign of failure. It's a sign of you being responsive in the way that you can for the economy that exists right now. And what I hope that you take out of this is that you can return to private practice. It's not a moral failure of a human being. Plenty of businesses of all kinds open and close. But with the hopeful ability to have some foresight when the economy does lighten up, when clients do return, to make some of the same kind of 5 to 10 year plan decisions as far as where does the world seem to be going. So that way you're positioned to hopefully be able to have the kind of resilient practice that makes sense for you.
As a therapist, your work extends far beyond the therapy hour. There's the administrative load, scheduling, documentation, billing, insurance, follow-ups, all of the essential tasks that happen before and after the clinical work you're truly passionate about. We know how quickly that admin work can pile up. Simple Practice is an all-in-one electronic health record designed specifically for therapists. With HIPAA-compliant tools and high-trust certification, it helps you avoid juggling multiple systems or cutting corners just to keep your practice running smoothly. Everything you need lives in one place: scheduling, notes, billing, insurance, secure client communication, and automated appointment reminders.
And if you're starting or scaling your practice, Simple Practice also offers credentialing services to simplify the insurance enrollment process, which can otherwise be a huge hurdle. We appreciate having systems that are built specifically for therapists, not retrofitted from somewhere else. Ready to simplify your practice? Start with a 7-day free trial and get 50% off your first 4 months at simplepractice.com/therapy reimagined. That's simplepractice.com/therapy reimagined.
And we have a lot of episodes where we talk to each other, but also to some of the other experts in the field. And we'll link to those in the show notes over at mtsgpodcast.com, where they talk about, or we talk about, different assessments to do, things that you can do to become more sustainable financially, what types of things to invest in. So there's a huge amount of episodes that we can link over there, or maybe we'll just put a keyword optimized. Here's the business ones that we talked about this, because we've been talking about this since before the pandemic. And it really is something where, we were not taught about business in grad school, nor do we think we should have been. And there is so much of this that it's about business. And so all of those things, Curt, I agree with. It can be a strategic move. It can be a potentially strategic retreat. In my case, one of the moves that I made felt like it was an ejection and then a regrouping. So there can be all kinds of reasons why we make shifts. I think if we hold tightly to what we think we should have, it can take us down and it can make it very unsustainable. So there are the financial reasons and benefits, those types of things where people might shift how they operate in order to make those hard personal decisions. This is what I need to do to work. This is how I need to do it. Another reason that I see for people moving from solo practice to group practice, or solo practice to community mental health or other types of agencies or treatment centers, is isolation and a lack of community. I know we had our interview with Eden, and she made that decision, so we'll link there as well. But it's very stark, the difference between working in an agency with colleagues and consult teams and all of the things, and working by yourself in solo practice, both clinically and personally. I felt it dramatically. I felt so isolated when I first moved to private practice, and it's hard. What was your experience moving from agency work to private practice?
I'm a naturally extroverted person. And so I filled a lot of the time as I was building up my caseload with networking and really just kind of being out and being on. And I think if I was just sitting in my office or at home all day trying to build a practice, when my wife would come home, she would be flustered with how much I would just be ready to talk and exude. And so for me, I kind of naturally started really leaning into working on building out my community network at the time. But what has really been happening even in our practice this week is we've had some higher acuity type things happen in our practice this week. And we have just kind of been commenting on nobody loves team meetings, but it's a really good thing that we have a lot of team meetings already set up. Because if we
Yeah.
were just relying on passing each other in the hallways in these higher work type weeks, it would still feel very isolating. But
Yeah.
we have structured type meetings where we're able to say, hey, how are you doing? When's the next time that you're taking some time off? I also know that you've got some other things going on in your personal life that even your off time doesn't seem like off time right now. You need to really take some space for yourself because it looks like you're kind of being worn down a little bit. And it's really nice to have a community that is kind of built in. I mean, I think my practice is phenomenal, and most of my employees agree. And
Most. You're the most.
and it's really something where that structure helps to sustain and keep people going. And it helps to normalize even just a lot of the reactions to the outside world. And one of the big things that seems to happen when economy shifts like this, we've done a couple of recession proofing your practice episodes in the past. And I think we correctly predicted 5 out of the last 2 recessions. And it's something where this time it does seem to be really real. And
Yeah.
one of the things that happens when you're working by yourself is that it feels like you're the only one who is going through this. But we'll include this link in the show notes as well. But according to the National Council for Mental Well-being, turnover among mental health clinicians is at 33% at the end of 2025. This is higher than any other healthcare field. So
Mm.
you are not alone. And some of the positioning of this episode is also, if you can afford it, don't just take an agency job to take an agency job, because you might be walking into something where you're just going to be feeling chewed up and spit out at another toxic work environment. So yeah, to your point, a lot of this is staying connected with community and staying very much with people that we can talk shop with, because we are one of the couple of professions that I can think of where what we do during the day, we can really only talk to each other about. The other one is magicians.
One point I want to make from the two of the things that you've said is we have a lot of folks who started their practices solo, working 100% virtual, and we have this huge isolation and loneliness that can happen in solo practice. Reflecting on your experience, you were more outgoing, you had a networking strategy, and you've now built a very warm, connected group practice. For folks who are sitting by themselves at home with their laptop and their clients, that can feel like a very big hill to climb. And so for me, I've built out my networks. I've done some in person. I've got some colleagues at my office. So I've created what I needed. But I want to honor that there are folks who are introverted, who potentially don't have a lot of resources. And so sitting at home by themselves, trying to build their practice and all of those things, it can feel very daunting to shift that. We've got episodes on joining a professional association. We've got talks about networking, and we may need to update our networking one again. There's a lot of things that you can do, and I think those things are required to be successful in private practice if you don't have a strong social support network or something that's going to sustain you beyond the work and the laptop. So this is a particular call to action. If you feel very determined, I'm going to stay in private practice, whether it's consultation, supervision groups, networking groups, professional association, find some connection at the level you need it in order to make it sustainable. Because you with the laptop in a dark room is not sufficient to keep this going.
Your time is valuable. Whether you're hyper-focused on admin tasks like billing or simply trying to make a cup of coffee between appointments, constant interruptions can derail your entire day. This episode is sponsored by the Receptionist for iPad, a digital check-in system that eliminates the need to walk back and forth from your office to the waiting room to see if your next appointment has arrived.
Clients or patients can securely check in for their appointments, and you'll be immediately notified by text, email, or your preferred channel. Break free from interruptions and make the most of your time. Start a 14-day free trial of The Receptionist for iPad by going to thereceptionist.com/MTSG. Make sure to start your trial with that link, and you'll also get your first month free if you decide to sign up.
One of the things that I wanted to talk about is more in depth is about the VC companies, and
Yes.
by extension of this is the artificial intelligence that is a part of our field already. We've had several episodes on this. There's, number one, the VC squeeze that even for some of the people who've successfully negotiated higher rates with some of the platforms, what we're seeing them report is they're getting fewer referrals, largely
Yes.
because they're getting higher reimbursement rates from the platforms. And the platforms seem to be sending those referrals out to places where the platforms could make more money off of them. For people who aren't on the platforms, we're also seeing lots of reports of competition with the platforms in places such as Psychology Today, where it seems that a lot of the other people's profiles in your area are being managed by companies such as Rula. And so if your solo practice is competing against a Rula marketing agent who's able to say, the picture that you responded to isn't available, but 15 other people who are on our platform are, that ends up being more competition. Those are some of the other pressures that people in private practice are feeling, but also the way that AI seems to be coming in is, according to LMFT's 2025 workforce study, 52% of MFTs who responded to this report are already using AI tools. And some projections by research.com's 2026 workforce report is that by 2030, 35% of clinical mental health tasks are going to be completely augmented and replaced by artificial intelligence. So this is really kind of the wake-up call that I am trying to send out to our audience, to the introverted people, to the ones that you're talking about, to the people who are just now starting to figure out, all right, well, what does business projections actually look like? Is how do you operate in the world that is going to be when you're ready to put yourself back out into private practice or within some of these agency models? Because some of the things that we've talked about in those previous podcasts is not going to be the world that people who are returning back to private practice are going to see. As much as people are going to try and recreate the private practice of 2018 or the private practice of 2021, looking at what is actually happening to our field and how you fit into that needs to be part of that equation. So if you are at home and you are one of the lovely listeners that we have who finds themselves in the introverted descriptions that Katie was just describing, that's okay. But I would encourage you to really evaluate what kinds of trade-offs you need to do to have a sustainable career within this field. It might be choosing, okay, I'm going to work for one of these agencies. This seems to be where I settle in. This is what I'm doing. I just want you to be able to do that in a way that is intentional and makes sense for you.
When someone is trying to create a private practice, let's start there. When someone is trying to create a private practice and they are more introverted, maybe they've fallen out of community mental health or other types of agency work, or even a group practice that isn't as warm and lovely as Real Honest Therapy by Curt Widhalm.
The warmest and loveliest.
The largest and loveliest, or the whatever the words are. Anyway, it can feel very daunting if there's not any familiarity with AI tools, with the landscape. And those are the folks I see jumping into even, oh, help us, BetterHelp, or the ones that really, truly pay awful rates. And so the most important thing that folks in that space can do is become more informed and do the research. If you're going to be home and wanting to do something active, listen to our podcast episodes, research the different technological advances that have been made in the mental health space, research the companies that you're thinking about joining or the insurance companies that you're wanting to credential with, because there's a lot of information out there. It's not all accurate because, of course, it's not. It's the internet. But there's a lot of information that's out there that can help guide some of the decisions. And so that feels like a doable task if you can get into a regulated space to be able to learn what you need to learn. So that's step one. For the folks who are going back and forth between agency work and private practice, or they're a group practice and their own solo practice, or even doing part-time agency or treatment center work or that kind of stuff, it can be very hard to really see how to create a single career and a work week even. And so some of the stuff we've talked about, like systems of self-care and some of the other episodes that we have, can help to design that. But I know when I first jumped into private practice, I didn't know how to design a workday. And so I burned out. I was doing tasks that were not driven towards financial stability or even billing anything. I was doing things very wrong. And so it took a lot to learn. All of these tasks, whether they're paid or not, are work tasks. Here are the things that are most relevant. Here's how I make sure I'm making money. Here's how I'm sure I don't get fired from the things I'm employed with from other people. This is how I continue to focus on whatever my goal is, whether it's more private practice time, all the folks that want to have like a secondary, like courses or coaching kind of thing. But getting clear on that when there's so many different pieces to it can be very hard. And so I want to acknowledge the hard and say, it's figure outable, whether it's you can do it on your own and you can kind of put it all on a piece of paper and put it over, or if you need someone to talk to and get some consulting or coaching. But I think there's a way to make it work, but it feels very daunting in the moment when you're trying to sort all those things out. And so I want to just acknowledge that this isn't easy if you're not saying, this is my solo private practice. I'm going to see 15 clients. I'm going to make the money I want to make, and that's it. And everything flows and it's all wonderful. It's not. It takes a lot more strategy than I'm just going to put together my private practice and all will be well.
One of the things that I think is important to say is that none of this has anything to do with your clinical skills. This doesn't necessarily mean that you are a bad clinician. And a lot of people are facing this. And this doesn't have to be an all or nothing approach. That unless you're moving into an agency that requires you to spend 100% of your time on site, there's a lot of modern agencies that have 4-day work weeks, that have kind of a work from home, at least part-time sort of position that can allow for you to scale back your private practice as opposed to needing to be all in on it. And this is something to just kind of give yourself a break on, but also really kind of looking at it from still that business sense. And some of the business stuff that you're going to really want to look at is your profit and loss statements. Those are really the hard realities of being in a private practice, of running a business, is looking at, am I spending 60-hour work weeks? I might have my 6-figure private practice, but if my net at the end of the year after paying self-employment taxes and all of the other compliance sorts of things is $48,000, that might not necessarily be the same kind of effort that you're wanting to put in that you might be getting $85,000 a year at an agency job that allows for you to have the flexibility to see 5 very niche clients that you really do want to work with privately. So some of these are some of the business skills that you have to pick up along the way and might need mentors or a consultant to be able to help you really evaluate what your practice is. I also want to gently nudge, if not challenge, if your practice is entirely on platforms such as Headway or Alma, really evaluating, do you have a private practice in place at all, or are you just a high-level gig worker? Because if all of the information that you are doing, all of the credentialing is done by these companies, it might feel like it's your practice, but if that is something where you're holding on to that as an idea, that might be one of the mental steps that you have to challenge your step to be able to say, what am I really holding on to? And if that is your own ego getting in the way to be able to make kind of what makes sense for you in what is a sustainable career? What is a sustainable position for the next few years, to be able to really look at what is most important to you in the larger picture of this process.
So our takeaways: 1, don't let your ego get in the way. Make choices that make sense for you. 2, make sure you have a network or a community that helps you navigate this career, because doing it by yourself isn't sustainable. 3, designing your career is actually work. It's structured, it takes a lot of soul searching, and it's something that may need some outside guidance to help you with, because it can be hard when you're in it. And 4, and this I'll cite you, Curt, is stability is sexy.
So sexy.
And building stability for yourself, whatever that looks like. It can be emotional stability and doing the work you absolutely love. It can be financial stability and making sure that you're making the amount of money you want to make and having benefits alongside, or some other form of stability that helps you continue forward. But it's okay if you're seeking stability and not this ideal practice that somebody in some coaching program has said is what is for you. There are so many options. Strategically choose which options make the sense for you right now, and then reassess, because it changes.
We will include links to a lot of the things that we're citing and a lot of our previous episodes over in our show notes at mtsgpodcast.com. Follow us on our social media, join our Facebook group to continue on with this and other conversations. And until next time, I'm Curt Widhalm with Katie Vernoy.
If you're looking to streamline your practice, we recommend checking out Simple Practice. Start your 7-day free trial and get 50% off your first 4 months at simplepractice.com/therapy reimagined. That's simplepractice.com/therapy reimagined.
With the receptionist for iPad, there's no more walking back and forth to check the waiting room for your next appointment. Receive an instant notification that your next client has arrived securely and privately. Visit thereceptionist.com/MTSG and get your first month free.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.